Before the pandemic, an estimated 50,000 adults in America died each year from vaccine-preventable diseases. On National Immunization Awareness Month, Dr. Sarah Schwertner from Primary Care Plus joins us now to dispel some myths associated with vaccines. Hi, good morning to you.
Good morning to you.
All right, so Dr. Schwertner, what are some of the myths that you hear as far as why people don't want to get vaccines? Why don't they want to get their kids vaccinated?
So, a lot of patients think that vaccines will actually give them the disease. And I try to take my time and educate them that the vaccines now are usually pieces of protein that your body recognizes that are similar to the diseases so that you can make antibodies towards the disease and that it won't actually give you the disease that we're trying to prevent.
You know, from time to time, we hear about sort of these older illnesses, if you will, like polio, popping up in people nowadays, and they're finding it's in people that are unvaccinated. Does that sort of underscore why, you may think of a disease like polio, for example, say, oh, that's not a problem now. You never hear of anybody getting polio. We don't need to vaccinate our kids for that. But does that underscore the need for, yes, you do, because these cases can still happen today?
Right. So we eradicated diseases in our country because of the capability of having a vaccine at a young age. And so those diseases are still active in other countries. And I think there is some, information out there that really confuses patients whenever they're thinking about vaccinating themselves or their kids. For example, we give our kids an MMR at a young age, and there's been a lot of, non-vaccinators that they just had a huge outbreak a few months back in measles, which was an eradicated disease in America.
There are a lot of vaccines that are important for older adults too. As you age, you do still have to kind of keep up with some vaccines. Can you explain for us what are some of those?
So, as patients get older, 65 and up, we recommend that they get the pneumonia vaccine, shingles vaccine, definitely flu, your COVID vaccines, and your COVID boosters to prevent, getting it in the hospital or having a worse disease if you were unvaccinated.
The flu vaccine specifically, I've heard people say, oh, I had the flu vaccine one time and then I got a terrible fever and I got sick. I must have gotten the flu from it. But you're saying that's not exactly true.
Right. So as of right now, we don't really give the live flu vaccine anymore. We just give the vaccines that have the proteins for the different types of flu. And so some people will get the vaccine and then their body has a reaction, such as muscle aches, fever, maybe even, a little bit of chills, but that's not the actual disease. So it's your body's immune system reacting to the proteins. And so honestly, if you do have a reaction like that, you should say, oh, wow, like my immune system's working. I'm building up antibodies. And if you really think that it gave you the disease, think about having those symptoms for 14 days, 10 to 14 days. It's not the disease.
The length of the flu, sure. Can you
Right.
talk a little bit about the FDA's process for approving a vaccine? It's not just, some overnight approval process.
Right. So it has to be tested on large amounts of patients that volunteer to be in these vaccine studies, and it has to go through thorough research before they put it out for the rest of the community in our country. And I think that people need to realize that because we've had the vaccines, it has eradicated diseases or even lessened the amount of people who have ended up in the hospital. And so that's what we really want to get the correct education out there that vaccines do save lives.
Gotcha. All right, Dr. Sarah Schwertner, thank you very much for your time this morning.
Thank you for having me on the show.
Of course.